Good afternoon, everyone. Welcome and thank you for joining us for this WorkSafe webinar today. It is great to have you with us as part of the 2021 Health and Safety Month. My name is Cameron Ling and I'll be your host for this session today. Now, while our program of sessions are virtual, we still have the same aims of Health and Safety Month that we do every single year, and that is to keep you up to date. The theme for this year, you learn something new every day. In this session, we'll be joined by two senior WorkSafe Victoria ergonomists, Dr. Tony Carden and Mohammed Abdrahman, who will present two very different case studies. These examples will show how using systems thinking methodology has identified failures and opportunities for improvements in the controls within two different industries and two very different hazard types. But now it's time to meet our expert panelists. Dr. Tony Carden is the Senior Ergonomist, WorkSafe Victoria. Good afternoon, Tony.
Good afternoon, Cameron.
Great to have you with us. And also joining us, Mohammed Abdrahman, Senior Ergonomist, WorkSafe Victoria as well. Welcome, Mohammed.
Thanks, Cameron.
It's great to have both of you joining us. And I know we're going to get into a number of different topics, but to start the ball rolling, Tony, systems thinking describes a range of human factors methods that help us to understand the socio-technical systems in which they exist. I played a little bit of footy a long time ago now, and we realised that football matches, teams, clubs and leagues are complex systems. My understanding is that systems thinking provides useful approaches to understand this complexity. It gives us a holistic view of behaviour and system performance and an understanding of how components interact and influence one another. But I have to add this, I'm certainly no expert. Could I ask you to explain broadly what systems thinking is and how it can be applied in a context of workplace health and safety?
Thanks, Cameron. Systems thinking recognises that the systems we live and work in are complex systems. Now, that might sound a bit tricky, and you mentioned systems thinking methods, but systems thinking includes both a set of methods, but also just simply a mindset. And you said you're no expert, but you might well be, because the sporting field is a lot like workplaces in that they are complex systems. And you can either think of it as somebody who works in one of those systems as just yourself and the ball moving from one end of the field to the other. Or while you're doing that, you can recognise that there's your teammates, your opposition players, the coaching staff nearby, the crowd, and many other people involved in that system moving outward from where you are. The same holds true in systems of work. We're used to managing our work systems as if they're a collection of parts, where if something goes wrong, we tend to look for solutions close to the problem. But systems thinking tells us that everything in a complex system affects every other thing. So by applying systems thinking, whether it be just the mindset or the more involved methods, we can better manage and regulate performance and safety in those systems.
Thanks for that, Tony. Over to you, Mohammed, if you could. When you talk about systems thinking, what are the systems you're referring to? What advantages does systems thinking offer over other ways of thinking?
Thanks, Cameron. Now, when we talk about systems, we're trying to talk about socio-technical systems. So whether interactions between the people, their equipment, information, work environment, and work practices, and even beyond that, such as the regulations and the external influences within that system. Now, in complex systems like these, where the relationships between the parts of the system, they're at least as equally as important as the features and the performance of each part in determining the outcomes. Now, systems are relative and they have no fixed boundaries. We define those boundaries relative to the problem that we want to address. Now, the advantages of systems thinking is that it allows us to gain a broader understanding of how the factors all across the system may interact and contribute towards an incident, and they can guide the decision-making and the prevention activities in applying the actions that will most likely have the greatest effect on the system.
Okay, so just following on from what Mohammed's talking about there, Tony, if we adopt systems thinking, do we need to abandon other ways of thinking?
It's a good question, Cameron, and one that I get often. And the answer is no, not at all. Horses for courses, you can find systems that can be well understood through more basic methods. You don't need to consider all of the aspects the broad system in every micro part of what you're doing. However, knowledge and practice in health and safety has grown and gained a lot of improvements over the years. It's hit a plateau, though, in our actual improvements in health and safety. So the reduction of injuries, the reduction of fatalities, they're not falling as much as they had been. So we need to look for new ways to further improve. And for WorkSafe, we're really keen to ensure that Victoria is the safest place in the world to work. We want to absolutely minimise injuries and fatalities at work. So we think that systems thinking is the next level way, the next tool to add to your toolkit, not to get rid of those other tools in the toolkit, but to have that at your disposal to better understand the systems of work.
Therefore, Tony, can I stay with you and talk about your case study? Your case study this afternoon examines the application of hierarchic task analysis, or HTA, to the assessment of COVID-19 risk in the international arrivals terminal at Melbourne Airport. What does HTA mean in lay terms, please, for someone like me, and how does it work?
Sure, it's kind of what it sounds like, hierarchic task analysis. So you look at a task and break it down into the subtasks. So you consider the whole big thing you're trying to achieve, and then you look at the steps needed to achieve that. And then for each of those steps, you see if you can break that down into further tasks, and you keep doing that and break it down into little understandable and digestible chunks. In the case of the airport, we used it to better understand the risks of COVID-19 transmission to airport workers from aircrew and passengers arriving from overseas earlier this year. And by talking with employers and employees at the airport, by observing the processes they were using, we were able to identify all of the tasks, all the workers involved in processing those international arrivals, and be able to, for ourselves and for those employers, better understand the specific risks involved.
And no doubt that's only going to become more important as more internationals arrive and the country starts opening up. But Tony, I wonder, how did you apply HTA to the process?
Yeah, so look, context is very important. So it's important to remember at the start of this year, there was zero community transmission in Victoria after we'd suppressed that second wave. There was pretty much zero community transmission in the other states. So Australia was pretty much COVID-free. And therefore, our biggest risk of introducing COVID was via these international arrivals. And remember that there were no vaccines then. Nobody was vaccinated. So we were very vulnerable. And so we were looking at the process that Melbourne Airport had implemented to safely bring those international arrivals in through the airport and get them through there to the buses that would take them to the quarantine hotels. So from the time each plane landed right through to where those passengers and crew would exit the airport, using HTA, we're able to identify each likely interaction between a crew member or passenger and a worker in the airport. And so by looking at those interactions in that sort of chunk down way, we're able to look at the different modes of COVID transmission and make an assessment based on the types of interactions we were seeing of how likely it was that there could be, a risk of COVID transmission, and therefore what controls needed to be in place. And for us, we were able to then prioritise and rank where the highest risks were and prioritise our conversations with employers to make sure the controls were up to speed.
Right, thank you for that, Tony. To you now, Mohammed. Your case study is about the application of the AXIMAP and PreventiMAP methods to identify contributing factors associated with the incidence of occupational violence and aggression in residential out-of-home care across the system levels. It also highlights opportunities to reduce those risks. What is an AXIMAP? What is a PreventiMAP? And how do we use them broadly?
AXIMAP is a technique that is used to identify the multiple and interacting factors that contribute towards incidents across and within the different system levels. So the contributing factors can be actions, events, decisions, or even conditions that have led to that incident in occurring. Now, on the other hand, PreventiMAP is a technique that is used to represent potential interventions that we could use to mitigate the risks that are arising from the contributing factors identified in that AXIMAP. Now, in the case of the out-of-home care project, we applied a three-stage process towards achieving the following project aims. So the first aim was to identify the actors who may share some responsibility for occupational violence and aggression within the residential out-of-home care sector system. And this was achieved by applying another method that's called the actor map. The second project aim was around identifying those multiple interacting factors that contributed towards occupational violence and aggression incidents within the residential out-of-home care sector, and we achieved that by applying the AXIMAP method. And the third and final aim of that project was to identify the potential interventions to prevent and reduce the risk of occupational violence and aggression in residential out-of-home care, the residential out-of-home care sector, and we achieved that by applying the PreventiMAP method.
Mohammed, how did you tailor those methods for this project?
Now, we used several approaches to tailor these methods, and we applied that through the following principles. Really, we used the first principle was around that shared responsibility for safety. Now, we really realized that occupational violence and aggression, or OVA in short, those incidents are created by decisions and actions of all actors across the system. So it's not just the frontline workers and the clients. We realize that actors across the system need to take steps to prioritize worker safety in their decision making. And we were able to bring all stakeholders to work collaboratively together in identifying those contributing factors and brainstorming those potential interventions to mitigate those factors. Now, the second principle was around consultation. We realize that OVA incidents occur when decisions at the higher levels of the system, such as government, regulators, and organizations, leaders within organizations, when those decisions are not reflected in practices that are occurring at lower levels of the system. And because that information at lower levels of the system, such as the staff, the frontline staff, some of the work practices, when those don't inform decisions and actions at the higher levels. Now, actors at the higher levels also need to know what is actually happening in the work environment, and this information needs to inform the development of policies and procedures, which would be then reflected in work practices. Now, by collecting data from all key actors in the system, we were able to provide a comprehensive and a well-rounded view of contributing factors and potential interventions to mitigate those factors. Now, the third and final principle was around education. So we try to emphasize a focus on prevention to mitigate the risk of OVA within the residential out-of-home care sector. By using a no-blame and an education-driven approach, it allowed for a good level of transparency and engagement from the stakeholders to identify the many constraints that were driving OVA incidents in residential out-of-home care.
Well, thank you for that, Mohammed. Really appreciate you sharing that with us. Tony, can I jump back to you for a second? How can systems thinking methods support OHS regulation and management, I suppose, more broadly?
Well, really briefly, Cameron, by offering a big picture view of work systems, as you've just heard Mohammed describe, systems thinking can help both managers and regulators like us to identify a wider range of causes of health and safety problems, which in turn gives us a broader suite of choices about how to prevent incidents and gain health and safety improvements.
So for those in the know, what are the common misconceptions about systems thinking? Mohammed?
Sure. So there are quite a few misconceptions about systems thinking, Cameron, but probably some of the key ones that I've heard very often. The first is that sometimes systems thinking is confused with critical thinking, with methodical thinking, such as systemic versus systematic, or focusing on specific work systems, such as IT systems. The other misconception was that people sometimes worry that systems thinking and methods are too hard or not needed, such as you often hear some people say, "Isn't what we're doing already good enough?" Now, I do acknowledge that learning and applying systems, some of the systems thinking methods, does require some effort, but it can be a very powerful tool.
Thank you, Mohammed, for that. And thanks to Tony as well. We're getting a heap of questions coming in at the moment. So if you don't mind, I'd love to shift to some of the questions coming in from our audience. The first one off the top, do we need to learn methods like HTA and AXIMAP to be able to apply systems thinking? I'm happy for either of you to take it, and please, either of you jump in if you want to add more to what someone else has said. But for the first question, hands up. Who wants to take that one?
I'll take it if I may.
Thanks, Tony.
Okay, Mohammed, feel free to add, of course. And it sort of harks back to what I said earlier. It's two things. Systems thinking is both a mindset and a set of methods. So you don't need any training or any reading or anything else at all to just simply shift your thinking to understand that everything's interconnected. What everyone does affects everyone else in your system. In terms of learning methods, there's a wide range of systems thinking methods available, very many of them. We've focused on a few of them, but there are many of them available, and there's many ways of accessing those. So it doesn't have to be difficult, but it can get as involved as you want to make it.
Mohammed, do you have anything to add to that?
Yeah, if I can add to that now, with there's a lot of systems thinking tools and techniques out there. So you have to find really what suits your, I guess, the aims of what you're trying to do the best, to try to find that technique or tool that will give you the most outcome in terms of outcomes. Now, in terms of that mindset, I would like to add that it's about trying to think bigger picture. With systems thinking, often we get too focused on what's happening at the frontline level with incidents in terms of what went wrong, in terms of people committing, errors or violations, in terms of failures within equipment, in terms of issues related to that work environment. But what we're trying to achieve with systems thinking is trying to look up in terms of what's happening in terms of work practices, in terms of that organizational level, that top organizational level. What is the organization doing that's driving those issues at the frontline level? And again, with systems thinking, you're looking higher up than that. Sometimes there are issues beyond the control of the organization, the regulatory environment, the government policy, budgeting, external influences that are happening across that system.
Thanks for that, Mohammed. A number of people, Tony, are asking this question. Are these tools available on WorkSafe's website?
So at the moment, there are a couple of tools, one that's well established, one that's going to be released early next year. The first is called the FHIRS tool, and that's an acronym, PHIRES, Patient Handling Injury Reporting of Systems. I think Sharon will kick me if I got that wrong. But anyway, it's a way of using systems methods to identify causes of patient handling injuries in hospitals. Now, on the basis of that successful tool, a more generalised tool has been created for the healthcare and social assistance sector called STIR, which is Systems Thinking Incident Review, and I know I got that one right. So that will be released early in 2022. So we are having a number of conversations both with our external research advisors and internally at WorkSafe around more general apps and tools that can be used to analyse incidents. But I would emphasise that you don't need an electronic app. You don't necessarily need a computer program to use any of these methods. Hierarchic task analysis, AxioMap, PreventiMap, causal loop diagrams, any systems method you can think of can be done with a pencil and paper.
Thank you to both of you for joining us today, Tony. Really appreciate your time.
It's a pleasure, and thanks for your time.
And big thanks to you, Mohammed, as well. It's just great to have a chat to you about all the great work that you're doing.
Thanks, Cameron, and thanks to everyone that has attended this session.
Yeah, big thank you. I back up what Mohammed's saying there. The WorkSafe Victoria website does have a heap of great resources, guides and tools that can perhaps help you with the answers to some of those questions I didn't get time for. WorkSafe is always helping to ensure Victorian workers are supported to get through these very tough times. Systems thinking can play a very valuable role in identifying hazard types to identify and mitigate workplace health and safety risks. That's the end of our webinar today. We hope that you found it interesting and informative. Just an important thing to remember too as well, if you do have something urgent that you need to discuss, there is the WorkSafe advisory line and emergency line. So please use that resource if you have something urgent there. We will have on the screen shortly a list of some of the contacts that we've talked about today that you may find helpful. If you have any further requests for information, please, I encourage you to get in contact. But thank you so much for joining us today, and all the very best. you.